that because the movement to manage cancer will be a metabolic one. There's a lot of firewalls that are preventing us from moving in that direction. But my first step is to solidify the scientific basis for why metabolic therapy should become the standard of care for managing cancer. But in order to do that, you have to be on a bedrock of scientific evidence, because if the science tells us that this is the way to go and you're not going in that direction, then there's something else going on here. So you need to know that the platform upon which our approach for managing cancer is based on hard science, and evidence is accumulating to show why metabolic therapy for managing cancer will become the standard of care. It's just a matter of time. So we're focusing primarily on brain cancer because the situation for that type of cancer is completely abysmal. There has been no major advance in 100 years. So in my latest paper, like we have glioblastoma, it killed Ted Kennedy, it killed John McCain, it killed President Biden's son, Beau, and it killed a lot of other people. And these people are all dying within 15 months to 2 years. And when you go back and look at the literature, in 1926, survival for glioblastoma was 8 to 14 months. In 2022, it's 8 to 16 months. So in 100 years, I mean, we've got the Webb telescope. We've got all kinds of things that have happened in technology in 100 years, and we haven't made a single advance in glioblastoma. And I said, what the hell is going on with that? You know, this is this should be an embarrassment. We have people that are willing to take their lives. They go to Oregon and they die with dignity rather than going through the therapy for glioblastoma. I mean, Brittany Maynard did this. She has a big article in People magazine about her decision to die rather than go through the standard of care. I mean, this shouldn't happen in 2022. So I wrote a paper, several papers. Why is this the case? Why have we made no major advances? And when you look at the survival curve for all the patients with glioblastoma, it's like you cannot design experiments more consistent and reproducible than how fast GBM patients die after being diagnosed. And the issue is it's the treatment itself that's killing the patients. The treatment itself, can you believe this? It's the radiation and the chemo.
Yes, I can believe it.
Well, yeah, but I have shown the scientific evidence to support it. I've shown how radiating the human brain frees up massive amounts of the two fuels that drive the fermentation metabolism of the brain cancer cells. The cancer cells can't live without fermentation, which is energy without oxygen. All of us are breathing. We get our energy from the oxygen that we breathe. Cancer cells don't use oxygen. They ferment. So, and again, they're macrophages, the really invasive ones. And what do they eat? So all you have to say is, what do the cancer cells eat that keeps them alive? Because without energy, nothing can grow. And people say, how do you know? Take cyanide, see how fast you die, right? Cyanide, you're dead instantly. Why? You stopped all energy metabolism in the body and you die. Cancer cells live in cyanide. So clearly they're not respiring. So Warburg showed that years ago. I mean, you could pour cyanide on a tumor and it didn't kill the tumor. Kills the host, but not the tumor. So cancer cells don't need oxygen. So they ferment. So what do you ferment? You ferment glucose and glutamine. Those are the only two major fuels. And we have evidence, we published evidence on this. Okay, so if they need glucose and glutamine, how do you stop them? You stop them by taking away glucose and glutamine and transitioning them over to ketone bodies. They can't burn ketone bodies because you need good oxygen metabolism to burn ketone body. So what do we do to the cancer patient? We irradiate them. Okay, so when you irradiate somebody's brain, you free up massive amounts of glutamine in the microenvironment. And because your brain swells from the radiation, you give high dose steroids. And steroids raise the blood sugar level in your blood, like almost like a diabetic level. So the glucose is pouring in from the bloodstream. The radiation causes blood sugar to go up anyway. And then you're freeing up all this glutamine in the brain. And then they wonder why everybody's dead. I mean, it's so clear. And then when we took one guy Pablo Kelly, who has a podcast, and said, Pablo said, I don't want any of that crap. He said, I'll just as soon take life into my own hands. So we put him on metabolic therapy. He's out 8 years with he was considered terminal. And everybody says, oh, he's a fluke. Yeah, okay. He's a fluke, right? Well, how many other flukes would you like to have? Because we have them coming down the pike, one after another. As I said, if you threw 100 guys, 99 guys out of an airplane with no parachute, you put a parachute on one guy and you say, oh, he's a fluke. He's not a fluke. And you don't want to use that.